Right, we're back with complications. That is a very nasty, infarcted, yucky looking ovary, and that's what we're trying to avoid, and that's what can happen. These complications are applicable to all of these cysts. They can more or less happen to all of them. So to revise, we've got our endometriomas, the most common, then our functional cysts, follicular and luteal. We've got our cyst adenomas and our teratomas. Okay, so what kind of complications do you worry about with ovarian cysts? It's going to be very dramatic. We're going to do it live on camera. Okay, so the first one we have is rupture. A cyst can rupture its contents into the pelvic cavity. A cyst can hemorrhage into itself. And finally, this is a very dead looking ovary because it's torted. Okay, so those are the main complications of cysts: rupture, hemorrhage, and torsion. The way these are going to present are going to be with sudden, severe pelvic pain. In the case of torsion, sometimes what can happen with an ovary is that it can taut and untort, taut and untort. And that's called a cyst accident, a ridiculous name. But in moments where it's torted, somebody could have acute severe pain, but then sometimes it's positional and it untorts, and then that pain goes away. But if it's properly torted, the pain is going to be severe and acute, and it's going to get worse and worse. And the end result is potentially an infarcted ovary. So that definitely is going to need to be looked at surgically. And in fact, most of these, if there's a rupture or a hemorrhage that's causing severe pain, and torsion definitely, they're probably all going to need, these two are probably going to need surgery. That one is definitely going to need surgery. And what you would do at surgery is if it's ruptured, you remove the contents that has ruptured, and you remove the cyst wall and the cyst itself. Here, you're going to remove the cyst that's been affected by the rupture, and you're leaving the ovary intact in these cases. If you've got torsion, what you're going to do at surgery is you're going to carefully untort that ovary and see whether you can establish blood flow and the ovary is still alive and you save it, or whether once you've untorted it, it's too late and the ovary has died and it has to be removed. Okay, so complications of benign cysts: rupture, hemorrhage, torsion, and they are probably all going to end up needing surgery. Sometimes these are not so severe and you can just watch them, but this one definitely is going to need surgery. That is an acute abdomen.